Henrietta, it's great to see you and thank you so much for joining me today. It's obviously a very important time with Global Immunisation Week, and of course UNICEF has launched Immunisation Agenda 2030 along with other partners of the WHO and GAVI, and you're hoping to save over 50 million lives. Is that feasible?
Tania, thank you so much for asking that question. We think it is feasible. And in a time like the pandemic for COVID, it makes you realize that every life is important. And if we could save 50 million lives in the next few years, we should do it as a world.
And tell me the strategy behind it. How will it happen?
Well, immunizations are a very interesting and complex activity. About half of the immunizations and vaccines in the world come through the doors of UNICEF. And it's because of routine immunizations for children, things like measles and polio. And what we are saying that we can accomplish as a world is if we can immunize 90% of the children, and we have a chance as a world to save lives. So polio, measles, yellow fever, all of these are vaccines that children need, but they're also vaccines that adults need. So we are asking for families to come into primary health clinics in their own communities, bring their children in, get vaccinated for these childhood diseases, also get a COVID vaccine, and we can save 50 million lives. So it's going to take a lot of work, but we think we can do it as a world.
What are some of your biggest challenges, Henrietta? Because of course the focus and all the support financially and of course from global leaders are going towards the vaccine for COVID-19. So the others, are they being left behind?
Tania, they are being left behind. And we have in the world a cohort called zero-dose children. So they're children that have never had a chance for a vaccine. They are usually in the lowest income countries, in the poorest communities. They're marginalized. They're difficult to reach. But our vaccine partners in every country do whatever it takes to get vaccines to children and to community clinics. So we use donkeys and drones, people on foot, people in cars, in trucks, in trains, whatever it takes to get vaccines out to these children, to these zero-dose children.
Is it hard to focus global investment and collaboration to support the goals of this Immunisation Agenda 2030?
Yes. The numbers look large. Under the COVAX facility, there's been a call for $23 billion, which sounds like an enormous amount. But really, when you look at global GDP and what is available in the world, it's a very small number. It's less than 2%. So you realize that as a world, we could afford this. And if we could get vaccines out to children and to adults in the coming years, we will be a world that would have more equity, more fairness, more health across the board. There's one other area, Tania, that we need help on in financing. UNICEF has a call out for $659 million, and it is to try to help primary healthcare systems in countries. Many of these countries are very, very fragile. They do not have running water and a bar of soap, even in their hospitals, much less in a school or in a clinic. So we need to try to help the world build primary health centers. They can just be a small center in your village. It can be a large hospital in an urban center. But with such a primary healthcare system, our world could approach epidemics like measles or polio, but also pandemics like COVID.
What more would you like governments around the world to do to help UNICEF, GAVI, WHO to achieve these goals?
Well, Tania, our number one call is for donations. If countries have extra doses, we are hoping that countries could set aside 5% of the doses from their population so that they could help other countries that are much poorer, cannot afford to buy their own vaccines. Donations are beginning to come into COVAX. That makes a difference. Donations of every sort are helpful. The second thing we really need is for countries to realize that routine immunizations need to take place. We have about 60 campaigns that have been stopped because of COVID. So for governments to say to their people, we understand that routine immunization campaigns will need to come on because we want to strengthen children and their health around the world. So that's the second thing that governments can do. A third is that there are sometimes import or export restrictions on raw materials, on vaccines. We would like governments to lift these, and we would encourage private companies to share and partner their intellectual property rights so that more manufacturing can be done in other continents around the world, and that will help all of us. So there's lots that governments can do, there's lots that private industry can do, lots for nonprofits, and lots for us as individuals.
Of course, we're seeing the COVID-19 virus intensifying in certain countries. And I'm thinking about India. How worried are you about that situation? Do you think it could have been preventable?
Well, we're very worried about it. And I know that all of our colleagues in India are also very worried about it. And you have seen the reports, first-person reports from journalists in India. It is worrying for several reasons. One, is it a precursor to what might happen in other countries, particularly countries in Africa with much weaker healthcare systems? It's worrying because their healthcare system has been overwhelmed. It is the need for oxygen and therapeutics that we just have not seen in this pandemic in another country at this scale. And third, it is worrying because individuals are trying to keep themselves safe, but they had not realized that there was going to be such a need. We find that with the variant, there's a double variant that's abroad in India. And we find that whenever we give the virus a chance to mutate, it begins to mutate. So we are worried on a number of levels. Countries are coming in with help, with donations, and that makes a big difference. UNICEF and the COVAX facility have sent help, but it's not enough because India is part of our supply chain. So it is both where we source many of the vaccines, it's also where we need to give help as a world to India now.
Henrietta, in that current environment, what you're talking about, how hard is it then to launch the initiative that you have done?
Well, we think it's a perfect time because people now realize that vaccines are important, that vaccines work, that they save lives. And right now we are in a race to save lives. So if we can save them through a routine immunization program, reaching out to everyone in a society, that will help both routine immunizations and it will help COVID. So you get a synergy here, 2 for 1, where the world can really step up and say, this has not been good enough. Vaccines have always been inequitable in our world. We have not been able to reach some of the zero-dose children. So why not now? Why don't we improve our primary health care? Why don't we get vaccinations and immunizations out to everyone?
How worried are you about some of the world's children living in the poorer countries?
It's a race to save lives. In the poorest countries, these healthcare systems are very, very fragile. The other thing that's very fragile is that there is not a sense of trust, of understanding what difference it would make. So we've seen that in the Democratic Republic of Congo, for instance. When Ebola first came there, people had not seen it, so they did not know what it was. They didn't know why they had to stay safe. But we need there to be trust that when your healthcare workers, when your doctors and nurses in a community, when your government tells you that it's time that you need to be careful, put on a mask, practice good hand washing hygiene, that we try to do it as a world. So that's a very important part. And in the poorest countries, The methods of communication are often less well developed, but we are getting word out with handbills, notices on buses, radio, television, social media, everything we can use to try to tell people how they can keep themselves and their families and their neighbors safe.
And as the executive director of UNICEF, what is your message to global leaders?
Well, help us now. We are worried that the world is not paying attention to things like routine immunizations. We cannot lose this population, our children, to one epidemic, while we are worried about COVID as a pandemic for our world. So please help us now. It is in this first half of the year that we need help in immunizations. If we can immunize children and populations before the school year starts for many in the Northern Hemisphere, this will be a giant step forward.
Henrietta Fore, thank you so much for joining me today.
It's a pleasure to see you again, Tania.